I'll give the floor now to Christina Roesel. So, Christina, you have a PowerPoint, or we try to be within the limits, but.
Thank you very much for the repeated introduction, and thank you also to Isolina and Michael for the invitation. I'm here to cover for my boss, actually, Delia Grace, who is involved. She's one of the senior partners in the Global Food Safety Partnership report that has been mentioned. She is also the program leader of the Animal and Human Health Program at the International Livestock Research Institute. For me, I'm a jointly appointed scientist with both ILRI and the Free University of Berlin in Germany. And I was invited to talk about some experience and the importance of capacity building in informal markets, especially in sub-Saharan Africa. So ILRI, for just very briefly, for those who don't know, ILRI is part of a consortium of agricultural research institutes. We have 15 institutes working in the tropics and subtropics, and our main common goal is doing agricultural research, generating evidence for improved health and livelihood outcomes in the tropics and subtropics. And ILRI works on food safety and improving human health together with a sister organization called IFPRI, the International Food Policy Research Institute based in Washington. And together with IFPRI for the past 10 years, we've been doing research on food safety in informal markets. So that is our target group, informal markets. As said by Listra, more than 70% of all the foods are marketed by the roadside, in the traditional and wet markets, in the villages where there are no supermarkets. So this is our target group of investments. And 70% is already a high figure, but if you look at East Africa, the milk market, more than 90% of the milk is marketed in these informal markets. And as we heard, that's not going to change for the next 20 to 30 years. So these informal markets, they're integral to providing food, nutrition security, but also job security, because there are so many people involved in the production and marketing of these foods. However, they're also very heterogeneous, and they're so difficult to organize, and that's also why we believe investors shy away from investing in these markets. They have to be organized first, and it's easier to do that when investing in the formal sector, of course. So, and what we do, what we also believe is that investing in those informal markets actually improves the health outcomes regionally. By investing into the formal sector, the export trade, we're improving a product that is destined for export into high-income countries or middle-income countries, but it's not going to improve the health in the region of Africa. However, how to deal with them now? With these informal markets. We found that previously, let me give you a quote first. One of my colleagues said, if 5% of the milk is non-compliant with standards, something is wrong with that 5% of the milk. But if 95% of the milk is non-compliant with the standards, something must be wrong with the standards. And we actually found that many of the standards, they have been directly copied from the European context. Some of them are dated back to the 1960s, so they're really not feasible within the local context of Africa. Also, you have standards, but then as a government, you also need to provide the enabling environment for these market actors to operate. You need tap water in the markets. You need electricity. You need a clean market space. You need inspectors, of course, that are trained and not corrupt. You need a number of inspectors. And also, we found that there are a lot of vested interests in these countries. When I say that 5% of the milk in East Africa is marketed through formal markets, often these very few companies, they belong to politicians. So they don't have an interest in some of the countries investing in informal markets, of course. I know this is a very bold statement, but we're working there, we know. So our approach is in generating evidence on disease prevalence, on critical control points. We're using value chain approaches. We're using risk-based approaches. We are pilot testing interventions that are light touch. We're not reinventing wheels of technology. We are trying to build capacity. And now, after the pilot phase of testing of interventions, we're going into more rigorous testing in large randomized controlled trials to increase the strong evidence, scientific evidence for policymakers. So we engage policy at a local level. Ministry representatives are always part of the work we're doing, but we're also trying to engage the regional economic communities, and we're training staff of these departments on using risk-based approaches for managing food safety. So our research mainly looks into foodborne disease risks from production to consumption, and as I said, we're trying to identify critical control points and where we can implement new technologies or improve the food safety by institutional training. And previously, we've been doing that a lot on the farm where the food is produced. However, that's very far away from the consumer. So as urbanization is growing, value chains, they tend to get longer and more complex. The consumer is far away from the producer, and improving a product on the farm might help in some cases. But often, the problem we found is contamination at points where products are aggregated and then later disaggregated to a number of consumers. So that image on the slide represents the case of milk. You know, you have a number of farmers, traders go around in the villages, collect a liter or two from the farms, and then bulk it in big containers, take it to the market. And if one farmer has a mastitis cow, the entire batch is contaminated, of course, and that is now sold to a number of customers. And that is the same for meat. There are only very few slaughterhouses in the urban centers, and their animals come in from all different areas of the countries, and then there's a lot of cross-contamination at the slaughter point, which reaches the consumer. So I'm just going to give you very briefly some examples of capacity building and technology interventions we're testing. Many others are mentioned in the report, and I'm not referring to very technical, the technical results of it. So, for example, in Kampala, where we used to work on pig value chains, improving pig value chains, we implemented biogas at the slaughterhouse to improve the sanitation at the slaughterhouse. If you look at the picture left top, that slaughterhouse doesn't have the capacity to slaughter 200 animals a day because the demand has grown so much over the past few years. So there's a lot of contamination, cross-contamination going on, and most of that meat that is slaughtered there is sold to the entire urban population of Kampala. So intervening there at the slaughterhouse, trying to reduce cross-contamination can turn the meat into a safer product. Same, we're testing insecticide-treated nets at a cost of $1.50 per butchery, which is something that the butchers can adopt. They can use it for 2 years, and the customers appreciate less flies on the meat, and of course, less flies contaminating the meat. We're also not, as I said, reinventing the wheel, but we're using tools that have been developed by WHO, by medical research councils, and by other NGOs, improving good hygienic handling practices of the food handlers, because previously training has focused on farm production and not so much in the market. So this is a very cost-effective intervention, training food handlers. In Nigeria, for example, the return of investment for each dollar invested into training was $39 in preventing disease and improving the product. So in Uganda, since I showed you those examples from the slaughterhouse, the private sector has actually picked up our training curriculum modules. Of course, they came in a package, and they're used for farmers' trainings now. And within only 2 years, 20,000 people were trained, and these people, they were not forced to do the training. They signed up voluntarily. They wanted to take that training with the private company that is now selling the training package. So there is a large demand and willingness to learn and to improve, but there is little supply. So, and now our latest approach to improving food safety is pulling at the consumer end of the food supply chain. So especially in countries that are better off, for example, Kenya, South Africa, as compared to Niger, where the consumer is not really in the position to demand a lot better quality food. We're trying to pull on that end and trying to find out what do consumers like, what do they appreciate, what do they know about food safety, and how can we leverage that to incentivize behavior change of food handlers. Because a butcher is not going to change or set up a net if they don't sell more pork, if they don't have more customers, they don't make more profit. So, and that is how we are trying to understand the drivers of consumers in changing food safety. And that is the latest framework we have developed and that we're now researching more in depth. So I want to acknowledge our partners across Africa, in Côte d'Ivoire, Burkina Faso, Mali, Senegal, Ghana, in Kenya, Tanzania, Uganda, Ethiopia, and so on and so on. So, and thank you very much also on behalf of Delia Grace for inviting us once more, and thanks for the attention.
Christina.
Thank you very much, Christina, for a very compact presentation, very focused as well on livestock, which traditionally we tend to forget. We focus a lot on fruit and vegetables, but livestock is clearly important as much as aquaculture is. So thank you for your presentation and for your cases.